And can I just say that the service where I am is not great if I freeze up. I tend to do it during key times. It's not because I turned chicken all of a sudden.
Well, we're freezing here, so if you freeze up, that's okay. So we're just waiting for Kevin, right? Give it one more minute and get started.
And Christine, she should be right along as well. Is that you, Christine? Or not?
No, there's Kevin. Great. I don't know if Kevin's having trouble connecting to his audio.
Yeah.
I mentioned Jenna. She's the rec director for the town, in case anybody didn't connect those dots right away. Jenna, wave.
Good to see you, Jenna.
She's a very
Dave, it's
caring
been a
person.
while.
Right, it's been a little bit.
Yeah, and a couple new faces.
Yeah. Jerry, you're not in your awesome swing today.
Yeah.
I am back upstairs. I am not relegated to the downstairs. So
Okay, so you're happy with this. All right,
I love the swing, but I'm happy here.
good.
Okay, well, I think we're gonna get started. Maybe Kevin is backing out and coming back in. Oh, there he is again. Oh, he has his audio. Okay, I'm gonna, hey, Kevin,
Okay, sorry about that, everyone. Technical difficulties. How's
what happens?
Hey, Kevin.
Hi, Kevin.
everybody doing?
Good.
So when I call the meeting to order, for tonight's agenda, we have Sammy and Erica from the Reading Coalition for Prevention and Support going to be talking to us a little bit about that program. And then we have a big chunk of COVID-19 updates. We turned red today, as many of you probably know, unfortunately. And so we have a lot to talk about there. And then Jean is going to give us an update on what happened 2 nights ago at the select board in terms of our budget. And then we have those minutes to approve. I wanted to let people know that we are very close to hiring a public health nurse. At our last meeting, we were inches from hiring a public health nurse. We are now microns away from hiring a public health nurse. But I've been instructed to say that we haven't done it until whatever the fat lady sings or whatever that thing is, until it's signed, sealed, and delivered. So hopefully by our first meeting in January, we'll have a great announcement to make, but we're getting there. So let's see, in terms of public comment, I don't see any member of the public there. So I think we can move on. So we've heard a couple times in our meetings about the work that the Reading Coalition has been doing. I think Bob has mentioned it at least once. And, you know, given that we're hoping to do a community needs assessment and the community health improvement plan in the first 6 months of next year. I thought it would be good for us to learn more about what the program is doing, since it's clearly related to the health of the community. Erica and Sammy gave Peter and I an overview, which was great, and it was very impressive. And so we invited them here tonight to talk to us about the program. So we have, I would say maybe 30 to 40 minutes. And I think there were several board members who, like myself, weren't familiar with it. So it'll hopefully be helpful. So I'll just turn it over to you both.
Great. Thank you so much for having us. It's great to have Peter on board. We're so excited to have an interim health director, and thank you to all of the Board of Health members for all the work you've been doing, and your predecessors, especially during this unprecedented pandemic. It's been really impressive to see how many people have come together. So thank you as an employee and as a resident of the town for all the hard work that you all have put in behind the scenes that many don't see. We appreciate it. Sammy and I want to talk to you a little bit about our work, and I'll just double check with Jean if it's okay to share our screen.
Technology is ready. I would defer to the chair.
Okay.
Absolutely, go ahead.
That's okay? Okay.
Yep.
All right. Let me just get us to the beginning. So sorry. Here we go. All right. So just a little bit about me and Sammy. So we are the Reading Coalition, the staff people. We have a lot of volunteers as well that we'll talk about in a few minutes. I'm the director of the program. I've been with the town of Reading in this role for the past 12 years. Prior to that, I was at Lowell Community Health Center in Lowell, Mass, working in developing their youth development programs, and was very proud to serve there before coming here to Reading. Sammy has been with the coalition for a year. Prior to working with the coalition, she graduated from Tufts University with her bachelor's in public health, and then was working for Respond, which is a domestic violence agency, and she was co-located with the Reading Police Department as our domestic violence liaison. So we got to be able to work together in that role. And then when our position opened up, Sammy was a great fit. So we have been so lucky to have Sammy in her role, and we're happy to kind of bring you some more about our work. So many of you may know the coalition was formerly known as the Reading Coalition Against Substance Abuse. We went through a name change about a year ago. We felt that our name change was important to kind of reflect the current work that we're doing, which is to be for prevention and support. Substance misuse is very much part of the core of our work, but we also wanted to make sure that the community knew that the mental health promotion support was also a part of our work. It did start as a town, police, school, and community initiative. There were a lot of residents and community leaders that pulled together to develop the coalition. And today the coalition is currently funded under the town of Reading within the police department. We focus on programs that relate to substance misuse and mental health promotion. So we have an advisory board. Kevin Sexton is one of our advisory board members. He's our liaison from the Board of Health, who we love having Kevin involved. The goal of the advisory board is to really bring together a lot of different stakeholders from 12 community sectors and across the town of Reading and beyond. We have some folks across the region. We exchange and share information. We get feedback as staff on our projects. And then we try to spread word about our coalition resources and events. Often our board members are the best ambassadors of sharing what we're doing, because they may be in circles, and word of mouth is one of the best ways to kind of spread information and let people know about some of the work that we're doing. So we do appreciate the role of the board and the support that they give us every month. Just in terms of our current funding, so we're currently funded as of October of 2019 under the Reading Police Department within the town of Reading. The town funds do support my full-time position, Sammy's full-time position, and our expenses. Prior to September of 2019, we were funded under grants. We did apply for 19 grants totaling 1.8 million, and we were awarded 1.6 million over 12 years. So all of those grants went to supporting substance misuse and mental health promotion. All of the projects that we've done previously, which also have a lot of data attached to them, are on our website. So if there's ever any interest in looking at an example of a best practice or a previous project, we have all of that there for the community as well. Some key prevention projects that we work on all the time is our mental health first aid program. We brought that to Reading in 2014. We were lucky enough to get a federal grant. And through that project, we've trained 800 adults in mental health first aid, which is an 8-hour class that adults can take to support young people to identify signs and symptoms of mental health issues and to refer them to higher levels of care. We also work with the Mystic Valley Public Health Coalition. We're one of 7 communities. Medford, Malden, Melrose, Wakefield, Winchester, and us work together to focus on opioid prevention and underage drinking. We meet basically every week to focus on projects. There is some state funding that's attached to that project. We don't receive any direct funds, but we do receive access to free training, support, and a number of regional project initiatives. We've been working a lot together during COVID, so there's a lot of great work that's happening with the Mystic Valley regional work that we do. We do have a medication collection program. Unfortunately, during COVID, we had to stop collecting medications. The reason for that is the facility that takes our medications is not open for us to be able to bring medications to, so it's temporarily closed in terms of medication take back. We do have some alternatives, and I'll talk about those in a minute. But just in terms of overall medication collection, since 2013, we started the program, we've collected 45,000 bottles of medication turned in by residents. A lot of medication that are no longer in people's homes, potentially being a risk to young people, and also an environmentally friendly way to get rid of the medications.
Erica, are those all controlled substances that are being turned in?
About 80% are controlled substances. We do get some over the counter, but majority are controlled substances. Currently during COVID, because of the restrictions on incineration of the specialty program that we have, we are using the state project, which is the MED project. Any resident can request a packet be mailed to them that has postage, and they can freely turn their medication in. Also, Sammy and I have access to special dissolvable packets, which you can take a bottle of pills, pour a little bit of water in. We have a little packet that looks kind of like Splenda. You pour the little packet in, mix it up, and it dissolves the active ingredient in the medication, and you can dispose of it in your trash. So it becomes another way to get rid of something, especially during the limited issues we have with COVID. We will be hoping to reopen the medication box as soon as we're able to. We also have co-located in our lobby area the Sharps box that the health department runs, but we don't manage that, you all do, but it is right next to our medication box. So typically people will bring in Sharps as well as medication. So together those boxes have helped a lot of people. We also oversee the anonymous text-to-tip program for the Reading Police Department. We started this back in 2011. We contract with a company called Citizen Observer, which encrypts messages so that people can anonymously text with our police. Typically, it's to report tips around drug activity, but it can be about anything as long as it's not an emergency. We have gotten some COVID-related tips that are then passed along, tips more around people not masking or social distancing, things like that. But any time a tip comes in, our officers review it, respond to the tipster, and then if it needs to get forwarded to another department, they do that as well. So it's just another way for residents to be able to connect with our police without fear of reporting something if they just want to be able to exchange information. We do a lot of school collaboration, a lot of work with the Reading Public Schools as well as with Austin Prep. We collaborate with the school nurses to run the ESPER program, which is the state screening, brief intervention, and referral treatment program at the high school. We do screen grades 9 and 11 every year. It is a verbal screening that our school nurses do, and then we do the data collection as well as referral to further services if a student needs that. We do health education classroom presentations, curricula consultation, and we are the survey coordinator for the Youth Risk Behavior Survey, which we do every 2 years. Our next survey is going to be done in the spring of 2021. So lots of data, and I heard that you're going to be working on your needs assessment, which makes me so excited. So we have lots of data, and we're happy to share it, and a lot of it's on our website, but if you're ever looking for interpretation of data or presentations or anything way that we can help with needs assessment, please call on us. We're here. And there's lots of great summaries available on our website. I'm going to turn it over to Sammy to talk a little bit about some of our intervention projects.
Thanks, Erica. So as Erica mentioned, we do a lot of work with the Reading Public Schools, and one of the programs that we run in partnership with the schools is our chemical health education program. And this was structured so that students who receive a chemical health violation, so for example, if they're found in violation of the substance use policy, maybe they have a vape on school grounds or alcohol on school grounds. If a student receives a violation, we created a program in which that student will be referred to take a chemical health education class that's taught by myself and one of the wellness teachers at the high school. And the function of this is to make sure that students are getting education around substance use, potential consequences, that they have an opportunity to work with us to think through some decision making and accountability, and then most importantly, access resources if they need some type of additional support or have questions around cessation. So this was designed so that students don't simply have a punitive measure levied against them. We really wanted to make sure that they're receiving education and support as well if they are found in violation. And the other intervention project that we have been working on is the crisis intervention team, which we have been running in partnership with the Reading Police Department. So the crisis intervention team is an innovative first responder model of police-based crisis intervention training to help people who are suffering with a mental health disorder or with a substance use disorder. And the goal of this program is to make sure that officers have the tools that they need when responding to a scene involving somebody who is experiencing a mental health or a substance use crisis, so that they're able to de-escalate that situation and assist that person in getting help rather than entering the criminal justice system. And this program began in the Reading Police Department around 3 or 4 years ago. To become trained in crisis intervention team models, officers have to attend a 40-hour training. So it's a pretty big time commitment, but so far we have 12 of our officers who have gone through this training, which is a pretty significant number for our department. And then beginning in January of this year, we began introducing a follow-up model. And so with the follow-ups, we are able to reach out to people directly to provide services in a calmer moment. So the people involved in this crisis intervention team are, of course, the Reading Police, who are our first responders, who do great work on scene to make sure that everybody is safe and that the crisis is stabilized. Then for any calls involving mental health or substance use concern, we at the Reading Coalition will follow up directly with the involved individuals after the crisis has passed to offer support in accessing treatment or additional resources if needed. We also are fortunate to have a partnership with Respond Inc., which is a domestic violence organization. And we have a counselor who is located, who splits time between the Reading Police Department and the Woburn Police Department. And this advocate is specially trained in responding to survivors of domestic violence and is able to provide confidential and specialized services. And then, of course, the Crisis Intervention Team International, which provides training and best practices for us. So with our crisis intervention or CIT follow-up model, the police logs are reviewed at least 2 times a week for calls that are related to a couple of different categories. And these logs are reviewed by Community Service Officer Kristen O'Shaughnessy. And she looks through all of the police logs, so which is pretty much the running list of any interactions or any calls the police have responded to. And Officer O'Shaughnessy will identify things that are either a domestic violence call, those cases will be referred to the Respond advocate, a mental health or a substance use related call, which will be referred to me for follow-up, or anything involving an elder or a senior citizen will be referred to the Human and Elder Services team, and they'll handle that follow-up.
Tammy, can I just stop you real quick for 1 second?
Yeah, please.
You did a great presentation on this last night, and I just wanted to chime in on that for the rest of the board. This is the first year that they've run this program, and it's turning out to be just an absolutely phenomenal resource. It really is. It was a great presentation last night, Sammy, and there's been some really good data coming out of this program, and it's really helping the town and its residents in a really positive way. So I thought this was a big one for you folks over at the coalition. It was a great job.
It is, absolutely. And thank you so much for that, Kevin. This has been, as you said, something we have taken on in the last year, and we have gotten tremendously positive feedback from the community. One of the most important things that we have seen is that people really deeply appreciate these follow-ups, even if they are not necessarily interested in additional services, or maybe they're not ready to move towards treatment at this time. So many people have just been so touched that somebody from the town cares about them and their family to follow up. So this has been a great program for making sure not only that the residents of our community feel heard and feel seen, but also that we're able to provide really essential services to people. And one of the big things is that we then, during this follow-up, again, after the crisis has passed, we're able to work with families to figure out, is there a barrier to care? Is there a reason they haven't been able to access treatment? Do they need health insurance? Things like that. And so we're able to support people in identifying, first of all, what resources could be helpful to them or to their family, and then identifying any barriers that they've experienced in trying to access those. And we're able to help support community members in walking through some of those issues and ultimately getting the support and the care that they need. And so in addition to our great partnerships with Respond and with the Human and Elder Services folks, we also work very, very closely with our school resource officers. And the school resource officers also are regularly reviewing the police logs to identify calls involving a child or calls where a child is present. So for example, a call could be if a teenager makes a suicidal statement and officers respond to the home, or if a child maybe witnesses an overdose in the home. So we're paying very close attention to make sure that any cases that involve a juvenile not only are receiving outreach from the coalition, but our school resource officers work very, very closely with school administration to make sure that this information is passed to the school admin so that the admin personnel is able to deploy the school-based services to help support this student. So we work very, very closely with our partners, both with the school resource officers and at Reading Public Schools, to make sure that the family is getting the care that they need, but also that the school is aware if there's an ongoing issue so that they can provide additional care for that student. And another great asset that we have available to us is the hub team. The hub team is a regional model, and for our area, the hub team is located or is operated by the Medford Police Department. But the hub team is a multi-agency approach specifically designed to support individuals with complex needs that require support from several different agencies. So for example, I attend the hub meeting every week. So there's representatives from different police departments, from coalitions. We have representatives from the Department of Mental Health, from Elliott Crisis Services, from the health authorities, health departments, the directors of social work from many of the area hospitals come, as well as Mystic Valley Elder Services. And the beauty of this is that we're able to get everybody in the same room to address individuals who are really struggling. And so we in Reading have had the opportunity to bring forward a couple of cases to the hub team to get support for individuals where we feel at the local level we have expanded or we've exhausted all that we can do, and yet this family or this individual still is really struggling. And so with support from the hub team, we're able to get some support very quickly. And so a great piece with the hub team is that since all of these providers are in the same room or on the same Zoom call together, it's a very quick and a very tactical meeting where we're able to outline how we're going to intervene in a high-risk situation very quickly. And so, for example, in Reading, a case that we brought forward, we were able to get support from Melrose Wakefield Hospital and from Elliott and from the Department of Mental Health to actually get somebody hospitalized so that we could assist them in getting the medication that they needed. So this team was able to do that very quickly, whereas we at the local level had kind of been spinning our wheels looking for a way to support this individual for a long time. And as Kevin mentioned, we are now nearly wrapping up the first year of our pilot program. So you've been calling the follow-up piece of this our pilot program. So again, we are nearing a year mark with this. So we have begun the process of reviewing some of the data that we have. And so we wanted to just very quickly share some of that with you. So this is the data through the end of November of this year. And you can see kind of broken down by either if a call was related to human and elder services, mental health or substance use, or domestic violence. And you can see that across the board, overall, it typically is we're seeing the most calls for mental health or substance use. And so between these three categories, we've responded to 424 calls as part of the crisis intervention team. 213 of those calls specifically involved mental health or substance use. 118 of those calls involved human or elder services, and 93 of those calls involved a domestic violence incident. And then more specifically, this is the data related to those 213 mental health or substance use calls. So of those calls, we saw that 143 of those were related to mental health, 57 of those were related to substance use, and 13 were related to both. Those calls that were related to both, we usually identify as if somebody was intoxicated and made a suicidal statement, or if somebody if there was an overdose and it was unclear whether or not it was intentional, is usually how we classify that.
Sorry, Sammy, that moved too fast. Are you okay with that?
Yeah, no, that's perfect. And so again, we'll jump into sharing just some resources that we have available to the community. Again, certainly the crisis intervention team is something that we've had really great success with over this last year. We're really looking forward to getting into our data from this first year of the program and figuring out where we can expand and how we can continue some of this work. But we've had really great feedback from the community, tremendous support from the Reading Police Department, and we're really looking forward to being able to continue. So to shift gears to some of the resources that we have, all of these resources are available on our website. So we have an updated substance misuse resource list. We have a mental health resource list, which gives people a lot of great options on how they can seek treatment. Also, of course, the Massachusetts Substance Use Helpline is available. Respond for any questions around domestic violence. NAMI, the National Alliance on Mental Illness, is a partner doing great work in the region. And notably, the Bridge Recovery Center just opened its doors a few weeks ago in Malden, and this is a peer recovery center that, as we said, just opened, and it's a really, really great resource for people in recovery. So they are hosting virtual programming right now, but they're doing a ton of different groups, and in the future, they're hoping to have created this community space that will be open after COVID, where people are able to come, connect, participate in community events and in recovery groups. We also have a specific COVID resource guide that's on our website. We keep this regularly updated, but we have a ton of really helpful information in here on things from accessing virtual support meetings for recovery. We have mental health treatment options, as well as suggestions for parents on how to talk to children about this crisis, and everything ranging from activities for kids to also resources if people need support in accessing food or health insurance. So again, we keep that updated, and the most updated version is always available up on our website.
So I'm going to talk a little bit about Interface, which is another resource that we offer to the community. So we contract with William James College, which is formerly the Mass School of Professional Psychology. They're located in Newton. We have a contract with them for them to provide what's called a matchmaking service for any resident that's looking to access outpatient mental health services. So the way it works is someone would call, and William James College Interface referral counselors would do a short intake and gather information so that they could try to find a few matches from their credential database of licensed outpatient mental health providers. And the goal is try to give residents a couple different options that have open appointments, meet their insurance needs and their location needs. So an example might be a mom might call for a 12-year-old daughter that's struggling with anxiety. They might go through some information, talk about some of the barriers that might be challenging the family. And then the Interface referral counselor will get to work over a period of a few days. They'll reach out to the providers directly and make sure that they do have room in their practice. They then call back to the person in Reading, let them know these are 2 or 3 providers we found for you. Here's their information. Here's how you set up an appointment. And then a week after, they check back in and see, were you able to get an appointment? How's it going? If it's not working out, they'll start the process over again and continue to try to work with a family to make sure a match happens. So we've been using Interface since 2016. So since the program started, we've had 308 residents use the program. When they call in to do their intake, they'll be asked a series of questions. And one of the typical questions is, why are you calling? What's the presenting concern, or the concern that you might be worried about for a family member? So what most of the more common concerns were related to anxiety and depression, followed by family-related concerns, attention deficit, behavioral issues, social issues, stress, addictions, suicidal ideation. Because this is an outpatient matchmaking service and is not a crisis service, if there's ever a concern about an immediate crisis, they will deploy those resources and make sure that that person gets connected to a crisis resource. But the goal is to provide outpatient matching services. So the helpline is available on our website. People can link through. We also have a web page on the Interface website. It's available Monday through Friday, 9 to 5. The phone number is 1-888-244-6843. You can leave a message. We know people might have tough schedules, so it's okay to leave a message if you get out of work at 6 and you want to leave a message. They'll call you back the next day if you let them know sometimes to get back to you. But everyone that we've talked to that have used the service have found it to be really beneficial. And it also takes out the stress of calling places yourself and getting discouraged if people don't have space or they don't take your insurance. And it's also hard when you have a crisis going on in the family to kind of keep repeating your story. So Interface takes some of the stress out of that. So that's a little bit about Interface.
I just say I was very impressed with this because if you're in medical practice, what you find is that insurances, if you ask them you want to seek mental health counseling or services, they will direct you to this very long list of providers. And it turns out as you call them, they've dropped the insurance, they're no longer covering, it's the wrong specialty area. It is a nightmare for, for folks. Certainly if you have insurance, I'm sure it's even worse if you don't. And so this service is really, I could understand how this could be incredibly useful.
And in the Interface database, there's 1,000 credentialed providers all across Massachusetts. Most providers quickly pivoted to telehealth services. So most of the providers are able to offer that. And that's one of the things they'll go through, obviously, during COVID is, telehealth and all of that, those kinds of things. And then also if there's an issue with computer access, kind of brainstorming some ideas around making sure people have connection. One of the other things that they do is they will add providers to the database if we request it. So if we have local therapists that we know are doing really great work, we can submit names to Interface. They will go through their credentialing process to make sure that there's no malpractice and that they meet their standards for being in their database. But we can recommend people from our local area. So if someone from Reading calls and wants someone local, they'll be able to find that through the Interface process. So if you ever have suggestions or know of great providers, please always let us know, because we're happy to have get them added to the list if they're so inclined.
And as Erica said, this is a free service for all Reading residents. It's paid for by the town, so any resident is able to access this really important service free of cost.
We also have a very extensive website, lots of great information, so many different areas. I can't cover it all, but from data to every presentation we ever do, we post it on our website. We have lots of great recordings from the last year of all the webinars that we've done. Sammy's done great work on vaping cessation presentations, as well as healthy relationships. So there's lots of great material on there. So we encourage you to check that out. And I'm just going to stop sharing so I can see all of your faces and make sure I don't miss any questions.
And certainly, as Erica was saying, we have some pretty extensive lists of resources available on our website, but please, anybody in the community should feel free to reach out directly to myself or to Erica. We are happy to help you whittle down what service might be most appropriate and help facilitate some of those connections. So, anybody can feel free to take a peek at our website, but if you have questions on a more specific resource or need some additional support, we are always available.
So that's great.
Any questions?
My only question was, all right, I Yeah, I imagine with the pandemic, you've been out straight.
It's been very busy. Very
Yes,
busy. Yeah. Yep. In a
but
good
it
way.
sounds like you're doing some wonderful stuff.
Thank you. I mean, the nice thing is, despite COVID, we found ways to connect with families and students and our colleagues to really share information. And that has been hugely helpful and has allowed me and Sammy to stay above water, I think, is to have not just the support of our department, but colleagues across the region and the state doing the same work and making sure that we don't drop the ball in substance misuse prevention or mental health promotion. But it's been busy. So we appreciate that people are still
Yeah.
reaching out.
I had just a couple
Yeah,
questions.
Carrie?
Thank you for the presentation. It's nice to meet you, Sammy. It's nice to see you, Erica. I wanted to ask about the mental health first aid. You're continuing to offer that regularly to staff throughout the town, is that right?
Yeah, so we this fall did mental health first aid for our new school staff. So any new teachers that were going through induction have gotten mental health first aid. We're doing professional development in January, so we're doing a mental health first aid refresher for those that have already been trained. And then we'll be offering a class for the community that'll be done virtually, probably in February or March. And anyone is welcome to take that. It's great for any adult. And I know Carrie's gone through the training. And it's great for any layperson. I am not a clinician, and I have found mental health first aid to just be hugely helpful to have a little bit in your back pocket to just notice and be a little bit more in tune and a little bit more empathetic to situations that involve mental health. As a parent, I found it extremely helpful. So I really encourage people to learn more about it. But we do have classes and we would usually promote those on our website. We usually do a press release, let the schools know, and we'll be happy to forward it to all of you. And Kevin, as our liaison, would know about it as well. So
Please. Great. I can't say enough about that. Having done the training myself, I actually was so impressed by it that I went ahead and got myself certified to be a trainer, and then I had to let that lapse. But it's outstanding. I can't recommend it highly enough. And I'm really glad to hear you're able to offer it to the community as well, because I remember taking it and sort of saying, oh my gosh, I don't know why all of my fellow parents aren't in this classroom with me. This is, so well worth the time. So that's great that we continue to make the investment in that. And then I want to shift gears, and I just want to ask about the hub team. Sammy, you mentioned that it's a tactical opportunity. And I was curious if there are criteria at which point you decide that you're going to present a case to the hub team. How do you decide?
Absolutely, that's a great question. So the hub team is usually we only bring forward cases where, first of all, we have identified them as very high risk and we don't feel as if we have the tools in our arsenal to be able to appropriately intervene. And also a case that feels like they could benefit from coordination between many different service providers. So that's one area where we have really struggled, is that sometimes it's difficult to get people's providers to connect. So somebody may have seen a doctor at Melrose Wakefield and might have outpatient services through the Department of Mental Health. And then the Elliott Mobile Crisis Response Team is called out during an emergency. Sometimes not all of those people have connected. And so with the hub team, we're able to get that whole team together. So usually the criteria for the hub team is that there is a high risk to either the person or to the community, and that we think there's a high risk for future harm. And so this is also done, we try to keep it as confidential as possible. When you present a case, we don't use names. Only the people who are going to be involved in that case, if it's accepted to the hub team, are given the name of the individual. So the broader team is not made aware of that individual. We'll just present the facts of the case. And then if we attach, myself and somebody from Melrose Wakefield and DMH to a case, the three of us will then talk in a separate breakout room where I'll share the information. But so we really do try our best to make sure that we are being as protective of people's personal information as possible, while also making sure that we're able to get services to people who, again, have really exemplified that they are in a high risk, high need situation.
Right.
And
That's-
in a recent example, I know one of the cases Sammy presented, I think after kind of pulling all of the different pieces together with the support of the hub team, there was 11 providers involved or something along those lines of, and at least a third of them didn't know the other service even existed. So it's super helpful to just have everyone on the same page, and then to plan for discharge from hospital, to plan for reintegration back into the home, to plan for medication compliance or support, all of those things that just, a person can start to begin that wellness, and then things can start to just disintegrate if we don't have that care coordination happening. And Melrose Wakefield has been a great partner, as well as Leahy. But again, the hub team kind of allows us to kind of cut through calling 900 people, because every Tuesday, Sammy knows she can go to the hub team and talk to someone from DMH or talk to someone from. And so if the health department ever had a case that they wanted to present, that's something they could always talk to Sammy about, and she could assist them in how the process works. And it's a resource that's available to us as town staff to bring cases forward if needed.
That's great. Thank you for, I'm familiar with.
Really
with
critical
similar
work.
models. Yeah, I'm familiar with similar models. This is really excellent work, and I love hearing the care that's taken about protecting the individual's confidentiality and working through the process, always in support. So
Yes.
thank you. Yeah, you guys really do wonderful work. Thank you.
Thanks, Carrie.
Absolutely. Totally agree. Well, thank you for coming. It's really been helpful, and I'm sure we will be in touch in the coming months now that we know what services. And of course, Kevin will keep us updated. How often does the advisory committee meet, or the advisory board?
We meet monthly.
Monthly. Okay.
Yep.
Okay, good.
Yep. Well, thank you all so much. We appreciate your time. We know how busy things are, and we're here if you need us.
Okay, thank you.
Thanks, Eric.
Thank
Oh,
you
it was
again.
well worth it to hear
Yes.
you.
Oh, thank you.
Absolutely.
Well worth it.
Thank you for your time. Have a good night.
Bye.
Bye.
You too.
Okay, so we're gonna move on to the COVID discussion and updates. And as I mentioned earlier, we're now in the red zone, in not a good way. And I'm thinking that although it's listed out in the agenda, we have a number of things to talk about. I wonder, since Genevieve's here, we might, Peter, start with the Recreation Department conversation that you had mentioned you wanted to have. You're muted. Peter, you're muted. There you go.
I'll get the hang of it. Just about that time, I'll go back into retirement and never have to use Zoom. It's the way it works, I think. Earlier today, Jenna, so we've spoken a couple times and we've emailed a few times too, but she's got it down to some pretty concise ideas. And, right now we're to the point that I think it's best if we talk about it with the board and what your concerns might be, but then I think Jenna would be prepared to, bat some concerns back to you. She's offered some ideas with signage. I don't want to steal all of her thunder, but we talked about getting folks there to monitor, and that doesn't seem to be feasible. But so I'm about beginning it with you folks. Knowing what we know about the indoor skating rinks and some of and Christine's down in the corner. She's not here facially, but she is hearing us, I'm sure. And she's going to talk some about, oh yeah, thanks, Christine. What we've encountered in the indoor rinks. And I really don't see there being a parallel between the concerns there and what's going on outside. So I know it's not really skating weather right now either, so we can take our time, but what does the board think? Anything differently since last month as far as allowing outdoor skating to go? I think last month we did talk about some monitoring.
I think what we talked about at our last meeting with respect to the outdoor rinks was a couple things. One was, potentially signage in those areas so that parents and kids will at least see what's expected, because it's hard to communicate otherwise. That if they are skating, people should be wearing masks. Whether we want to recommend that no more than 25 kids are on the ice at any one time, we should talk about that, but that came up as well. And then I would think, although it's like part of life now, is that people on the sidelines would be keeping their distance 6 feet apart and so forth. I think that, and we'll get into the indoor skating rink issues later, but I think that if kids are going to ice skate, it's better they're doing it outside than inside. And so we don't, and given all the constraints we're living under, I don't think we want to constrain this type of activity. We just want to make it safer. So I'd be interested, Genevieve, what you've been thinking about this and what the conversation has been.
Sure. So actually what you've just said is in line with what we were thinking. I did have a list that I had sent over to Peter just about the number of people per the guidelines right now. You said 25. I had 50 on my guidelines, but of course, a lot of these skating rinks are smaller. So we want to make sure that if it is a smaller rink, that we line up how many people are on there with the capacity that we have. And then we have on the rules that all skaters and spectators must wear facial coverings and practice social distancing at all times. When others outside of your household are present, no sports equipment of any kind is allowed on outdoor rinks except skates, skate guards, and safety helmets. So my team and I discussed that there should be no hockey played and no hockey nets, just recreational skating. And then we also, since the monitors really aren't feasible at this time, by the time we tried to hire someone, we have 4 rinks. So by the time we try to get anybody out there and hire them, it would probably be later in January, getting all of that squared away. And then there's that financial piece as well, because we do have to light the rinks as well. And then we have to pay for the staff. And then, so those random spot checks to ensure the guidelines are being followed can be followed by my staff. So during normal working hours and even once at night, my program coordinator who is in town said that she'd be willing to go and do random spot checks at night and do that during the day as well, just to make sure that those numbers are staying down. So my main concern is just the number of people that gather on the rinks, especially at Castine. That's a really, it's our biggest rink, but our most popular one, just because it's centralized at Birch Meadow. So I think just getting the number down of how many people, including spectators, are allowed down there would be the key piece there. But obviously, all of our rinks are covered in snow now too, so we do have a little bit of time to think about the guidelines. So I'm open to as many people out and staying active as possible.
Could I just mention before we turn it over? I mean, contact tracing came up, and we didn't know if it was possible to put a list together on who's coming and going and so forth. But I don't know how logistically that's going to work out. I think that would be a concern, especially
people just show up at these and just put on their skates and go. So
And
it's not a.
yeah, and I did actually.
that'd be a logistical night.
Yeah,
well,
I did
unless you do
actually.
it online, you want to register online, and then I mean, it might be ways. There might even be software available that would, sign in here, tell us what hours you're going, and that way we know you were there. But I don't see that happening this year.
Evan?
Just a couple of questions, Jenna. What are we talking about for typically on these rinks for numbers? What are the demographics? What are they actually doing? Are they skating? They playing hockey? what are we talking about on a normal winter? Do you have
Well,
that?
last winter we didn't have them at all because it was so mild.
So warm?
So I can't really speak to what happened last year, but in those good skating, those peak skating times that we've had in the past, there is a good amount of folks consistently using the rinks, and mostly in the evenings and on the weekends, obviously. And they are playing a mix of hockey and recreational skating.
And is it like kids and parents, or is it mainly kids split?
Yeah, I would say that it's split.
Okay.
Yeah, I mean, as I said, I'm not really out there on the weekends, and I'm only working until 6 or 7 o'clock at night, so I haven't really been out there viewing who's on the ice skating rinks all that much in the past. But from what I know and what my program coordinator has told me, because she's in town and she's right next to Castine, I'm just going by what I know from her and what I see posted on Facebook and all that good stuff.
Okay.
But they are highly used. We'd get calls, the ice would be frozen, and we'd get hundreds of calls in like a day. Well, not hundreds, but like a handful. So we'd get handfuls of calls and they're like, when are the lights going to be on? When are the lights going to be on? And we're like, well, the rinks are frozen now, but they have to be frozen for a certain amount of time for us to get the lights on. So
this sounds like a lot of folks that are used to using these rinks. In other words, you're not getting a lot of new drop-ins. You're getting the majority of these people use it year in, year out. They got their clock set to it. They know to call you to stop bugging you about the lights and what have you.
Oh, yep. And if it's after 5:30 or 6 and I'm out of the office, they call the police.
Okay.
So yeah, like the police is going to go down and turn on the lights for them.
Okay. That's helpful information. Thank you.
My question is, what are the hours of availability
So
for the rinks?
So it's pretty
Typically.
much dusk until 10 p.m. because they're lit.
And the lights go off at 10 p.m.
Yes.
automatically.
And then the weekends from daylight on.
Yep, same. The same hours, yeah.
Yeah, I mean, it's just I mean, people can skate in the dark if they want to. There's not any barrier to getting onto the ice. But so they could skate at 5 a.m. if they wanted to, but they could skate it as soon as the sun goes up until the lights go out at 10 right now. Okay.
The current, I should know this, but the current guidelines around outdoor gatherings in phase 3, step 1, is that 50?
Yes.
It is.
Yes, 50 for outdoor gatherings. Outdoor gatherings at private residences are 25.
Yeah.
But for out in the world, it's 50.
Okay. It would seem like we want to say that, but I just don't know how it could ever be enforced.
Yeah.
That's the real trick of all this is you can put up signage, you can inform these folks, maybe even Jenna, you may even have a list of folks that you could push information out to that are going to be out there chomping at the bit. You still have to enforce it, right? So who's that mechanism? Is that a regular patrol? We'd have to speak to Chief Clark about that, something like that, to see if that would be the enforcement arm.
Yeah, I'm trying to think out loud. I know that I did reach out to the folks at Play Local. So they have a reservation system for us that they use on the tennis courts. So people have to go and reserve their time on the tennis courts. They said that they don't do ice rinks yet.
Yeah.
So,
again, I think that's a tough thing to kind of, because you're just going to get kids that are going to show up with their skates and their sticks and their pucks. And they're going to have at it, and then you're going to create an environment where people are asking, "Well, did you reserve this time?" I reserved this time, and it could get really messy when you integrate the public into it.
agree. It's
Jean,
like a
did-
beach, you know, you can't really
Yeah.
block off a spot on the beach.
Yeah, Jean.
Thank you. I just want to share what I know about the staffing level at the police department. It's you know, they've got a couple of officers that are I think called into the military, and they have, you know, their staffing is not where it should be. So when we're talking about other things like enforcement of parking in the downtown, they're constrained to even do that.
Mhm.
So it's I'm sure they're, you know, willing to help, and they've always been very helpful, but I just think the resources there are limited. So worth giving that some thought.
And if we began with a hotline for complainants, so we could start to track, the behaviors in the first place. And, then there's repercussions. I mean, we flood these spaces right now, so they would turn into ice rinks. I mean, it can stop just as easily, I think. And so if there's a plan in place, first of all, if it's not going to be monitored except by the folks that are attending, then we need to let the public know if they're finding that there needs to be something reported. Where do you report it? Do you call the police, or do you leave? So something can go on the website, and then after that we can, communicate what, in different stages, what we're going to do next. You hate to threaten.
Paula, you had a question?
So I'm thinking that if you're having the signage and put that information there, this is where you contact someone for a complaint about noncompliance, put it there. That in itself may be perhaps a deterrent.
Yeah, I was thinking the exact same thing, is that the signage at these locations would have, wear your mask, 6-foot distance. We recommend no more than 50 people, and the limitation of what's on the ice, as Genevieve said. But I think that having, if you're concerned, or if there's, people not following these guidelines, text or call, a particular number. And I think that's probably the best we could do. And then maybe what's going to be required is, either recreation or health, sending out a health agent or Dan to drive by, or getting a sense once the snow does clear and these are frozen and people are starting to use it. If we're getting huge crowds, we may have to pull the plug, if it's really getting out of control. But I think maybe we could only tell that when we put up the signs, and hope people will do their civic duty and see what happens.
So next
I will
step here
say that oftentimes if there's too many people at a given place, they'll leave. A lot of people will leave on their own,
I would
just
hope.
not wanting to take the risk.
Yeah, I would hope. So do we need, I don't know in terms of what, as a board, our role is. Do we need to vote on an order, or is there enough information that Peter, you and Jenny, you can go and take that and write up the signs and the guidelines?
I know the one thing that usually helps Jenna in this scenario is if she can defer to the Board of Health's rules for this use, because she gets all the flack from any kind of rules, and that when she's talking about them, people go, well, why do I have to do that? Why can't I do that? So it's nice for her to be able to say, listen, the Board of Health has instituted these rules, and this is the guidelines you have to follow if you want to use the ice. It's as simple as that. Bring it to them if you have an issue. So I would say that it sometimes is helpful in that regard to have that come from the board more than come from the rec department.
We can handle it at the
Good point,
staff level if you'd
Kevin.
like. We can collaborate closer with rec than we have in the last month. And now that Jenna and I, connected, we can work something out, and I'll give updates on a monthly basis. But to Kevin's point, if you wanted to put on the sign, please reach out to health, Reading Health. If comments or complaints or concerns, then we can do that. And if that's okay with Jenna.
Well, one thing we could also ask Sammy and Erica is if we can hijack their anonymous tip text line.
Oh,
Where they get those in there, they can just kind of slide it right along to the right person over to Peter. I guess it would be the correct person to go to get that info, but that may be helpful to have signage out there that says, hey, you can anonymously text, there's going to be no questions asked, and that could be a good way to track what's going on over there as well, a little bit. I'm sure Sammy and Erica would be pretty happy to
She said,
let us use it.
yeah, she said that they were getting COVID texts
Right.
on that line.
That's right.
it's a good idea.
So that's a good idea, I think.
And I don't know if Carrie or Kevin, do we need to have a motion and a roll call in order for the Recreation Department to be able to say it's per order of the Board of Health? Or can, as Peter mentioned, given what our sense is, Peter and Jenna can interpret that and put that on the signage and say it's per order of the Board of Health? Do we need a formal, I don't know if we need a formal vote.
G question.
We're enforcing so we're
State
our co-equal powers with the state and the state requirements for public health emergency issues. So I don't know that it has to be by vote of the board. And I'm only hesitating on it, and I'm looking at Kevin because he's our parliamentarian.
I'm on the fence on this one. I'm not sure, Carrie.
So here's my concern, Kevin, on this, so it seems like we would have to vote to accept this particular set of guidance. And then it's kind of, do we vote to accept all of the guidance so that then we can vote to direct the rec department to enforce? You see what I'm saying?
Yeah, I see what you're saying.
Does that make sense,
Can Peter and I work on the guidelines and really hammer them out, and then bring something more formal to the next meeting?
You
Peter can
probably
present
should
it,
do
and
in
then you
that.
can vote on it.
Yeah,
It
you
would be
probably
nice
should
to
do
have
that.
it. Yeah.
If you're gonna vote, you really should have something that you're voting on. Right now, you're voting on an idea, right? Not
Yes.
something.
Yeah, I have something, but obviously maybe we'll reach out to Erica and ask her about the tip line and really button it up and bring it back to you the next time. I think we have a little bit of time since there's a foot of snow on all of the rinks now.
Right.
I
And
think
it's supposed to
we're
rain.
meeting in early January, right? We're meeting the first week,
January
right?
7th.
Okay.
Yeah, so that should be okay.
You think? Yeah. I was gonna say it's school vacation week between now and then. And so even remote learning would be, not going on, and kids are going to be out there. Do you think the snow? I don't know.
I've seen
them
them down there shoveling, Rick.
Excuse me?
I've seen the kids down there shoveling.
Shoveling.
Yes,
Oh, yeah.
totally.
Okay.
Yeah, technically, Mike Hannaford makes the decision to open up the rinks as well. So technically, even though they're flooded, And if people think they're skatable, they're not even technically open right now.
Okay.
Parks goes down and drills a hole down, and there has to be a certain amount of inches on the ice on each of the rinks for them to officially be opened by the town. So that's the other thing.
So it might be another week or so before they're officially opened.
Yes,
Can
but
we?
still probably
I'm
wouldn't.
sorry.
Oh, yeah, no, go ahead.
Don't, sorry, I just had a brainstorm, you know, they pop up.
Same.
Could we vote to direct Peter to work with recreation to develop signage for, specifically for the rinks? And would that be sufficient? I know it's still an
I
idea.
don't know if it requires a vote.
Yeah, I don't know that. I know
I
you're
mean, we're going full circle at this point and even tossing our fate to the wind, literally. If the weather is okay, then, you know, the skating will be okay. Let's
Yeah, see,
come back in 3 weeks and find out how we made out. And yeah, give us some, we got some guidance from you guys. We can get started and then we can monitor from there. Because, you know, you like to move slow, I think, in increments. And Kevin brought up a point, we don't have anything really to go on except what we're gathering tonight. I think the purpose was to get Jenna in here to hear some of the sentiment of the board, and we may be able to pull something together. We can report back in 3 weeks on January 7th.
I just feel though that 3 weeks is a long time.
I know.
Yeah.
You know, if it was 2 weeks, I might, 3 weeks is like the cat's out of the bag. And part of this is like you want, I think when parents and kids converge on these open rinks, you want the signage to be there. If it suddenly pops up a month later, then it's gonna be problematic.
So one option that the Board of Health could do is to not allow the rinks to be open.
Right.
Not actually a bad thought either. With holidays coming up, we have 2 weeks after the holidays before we meet. It's kind of a good timeline if you see where I'm going with this, from a transmittal standpoint. You know, and you can just you can just say we'll vote on January 7th to open them. As of right now, the Board of Health has instructed the rec department to keep them closed. Simple. And
Because we're red.
yeah.
In case counts are going up.
I mean, I hate to do that, but I think it's from a timeline, it's not bad post holiday.
Paula, you have your hand up?
Yeah, just to expedite things. I mean, next week, it's going to be kind of a wash. It's going to rain. It's going to be, the temperatures aren't going to be freezing.
Yep.
So the likelihood is low. But as somebody pointed out, school vacation is coming up too, which would be a prime time that people might want to start doing the skating. Can we perhaps put on Jenna and Peter to get the verbiage out to us before we meet, or even if we approve it before the next meeting, just to have it ready to go?
Well, I was
So we're
thinking
not
whether
delaying
it's
it.
possible, you know, from an open meeting law, is it possible that if Peter and Jenna got out something written with the guidelines that we could vote on,
Right.
That
Right.
maybe circulated to all 5 members of the board, you know, for comments back to Peter. But then could we have a 10-minute meeting of the 3 voting members of the board to then publicly vote on this? Do we have to publicly vote on this, or can we do it through email?
Quick answer to that is no.
Oh, we
And
have to do it.
I just say that, and I could elaborate, but I don't think
Please.
we want to hear my thoughts on that any deeper.
Okay, no, but that's fine. I mean, I think we could do a 10-minute Zoom call, you know, the week after next or something. And
You can meet as much as you want within a 48-hour time frame of notice,
Right.
or outside of a
Is
48.
that what we want? Yeah,
Well, it's either that or we keep the rinks closed until January 7th when we can do it in front of the usual board meeting time.
Yeah, again, I only bring up that it's a good timeline because we did see a spike after Thanksgiving.
Yeah,
Going to see a spike after Christmas rolls along.
Yeah.
It's not a bad idea to just wait to the 7th.
okay.
I hate to do it, but I mean, it's just not a bad idea.
Right.
That thinking.
that's worth a vote.
Okay. So why don't we go that route?
Look, before you do, as your director, and you've heard me say this before too, when you start driving things underground, that's not a good thing either. You start to ban public skating in public parks, then I'm not sure where that ball starts to bounce in Reading. I know where it bounced in my neighborhood growing up in Beverly. I don't think I would condone that ever condoned it when I was working in Danvers, just because people are going to find a pond and they're going to use it. And so something in between might work, but I mean, I hear the red, I hear Kevin, and I think it is reasonable. If you want to ban it, just know where I'm coming from, and I'm not making a recommendation to the opposite. So what am I talking about? Just a little bit more food for thought here.
So we don't know that the ice is going to be ready to be used anyways. They are not open right now. Is that what you said, Jenna? They're not open. They're supposed to post it because there has to be enough inches of ice. And, I've seen the messages in past years of, please don't, it's not safe. So
No skating, police take notice.
I'm wondering, I don't know. I suppose we end up in the same place. I was thinking, because we want to work in concert with recreation, and we would say that we don't want rec to open the ice until they've consulted with us. Which accomplishes the same thing. Never mind. It didn't really help us.
So
I
Peter, I definitely hear your point. I think we all actually made that same point last time to say if you ban it here, then they're just going to be hanging around their house without masks on. Actually, getting them on the ice with masks on is probably decreasing our ability to transmittal, right? So I definitely get that. This is a tough one.
yes.
Maybe you just take this one week by week and see how the weather goes. And if you feel like, it looks like they're going to be able to open this ice, maybe you do call a meeting, post a meeting for 2 days later and have a 10-minute discussion about language of it at that point. Something to Peter's kind of something in the middle. Don't take action now, but just, we don't need to, right? So
Right.
why take action tonight when you don't have to? Let it, kind of kick the can down the road a little bit here because we have some time and we can do it.
That makes sense as well. I think that if we could get something written, next week, then we would, and have board members have an opportunity to just send their comments back to Peter and Jenna, then at least we would be ready to go with a plan.
Yep.
And meanwhile, who is going to, and I guess what we would want to know when it looked like those ice rinks are ready to be skated on.
Yes.
And, if it turns out to be January 3rd, that's not going to be a problem. If it turns out to be December 23rd, we may have to move sooner to vote on an order.
And can I just bring up one other thing? Jenna, I heard you speak the language of not having hockey played on these rinks. I think to Peter's point, that's just gonna, drive these kids elsewhere to go do so. You'd almost rather have it in a controlled environment. Not that it's a ton of control, but at least there's some guidelines put out there. There's signage, there's regulations of, wear a mask, for the most part, and I don't drive around these a ton, but every time I'm over at the Birch Meadow Complex in the winter, the people I see playing are the kids. They got their shovels in one hand, they got their stick in the other.
Yeah.
You know, and they're out on that ice, and they're the ones that are actually clearing it
Yep.
for everybody else. And I don't know that I'd limit hockey from being played. Now, obviously, you know, no checking, you know, is a no-brainer. But I don't know that I think limiting that, I think, is essentially the same thing as shutting it down. Those kids aren't going to show up and just skate around. They're going to go somewhere else, and it's where they can play hockey.
Paula?
Would it make sense to designate 2 rinks for hockey and 2 for recreational?
That's a really good idea.
Hmm.
Because sites have all 3 sites have multiple rinks, right?
Memorial Park has 2, Sturgis 1 and Castine 1. But Castine is probably enough space that they could split.
Yeah, or you could count that.
But I know in the past too, we've had issues with the hockey nets as well. If
Yeah.
people keep them out there and then they fall through the ice, and we have town nets that were locked up last year because the ice wasn't safe, and we had folks go out and actually break off the locks from the public and put the town nets on the ice that weren't even theirs. So there's some discussions on that as a whole, but we were just thinking to limit the amount of contact with the sport would be smart. But I also agree with Kevin's point as well. So that's a tough one.
Yeah, I mean, I played pond hockey as a kid growing up. We really, it's not really a checking thing. I don't know what's played, you know, how these kids are going, if they're getting after it that hard now, you know, without pads on, and I don't know, but I think you can, you know, that could be part of the signage.
Yeah.
Non-contact hockey, or, you know, it's a great line right for the sign.
Right, no checking. Okay, so what I'm hearing is we're going to expect something in writing that outlines these, what the concerns and what our action steps should be. Sometime next week, we can run it through the board, so we'll have a document that we're ready to vote on if we have to before January 7th. That will, and you'll just let us know when the rinks are ready to go, and depending on the timing, we'll have to make a decision whether to wait until January 7th to do a formal vote or have a brief meeting beforehand. And I think that's
tonight being Thursday and town hall is closed, correct, Gene, right? It's not late. Sometimes, oh no, even on the late night it's closed. What you should do is Monday, get a posted over to Laura, Jem in the clerk's office for Wednesday night. So, you know, not to put anyone under a time crunch, but as of right now, that's the earliest that we could meet, because town hall is closed tomorrow, is Wednesday night with the 48 hours notice. But
I was thinking that if the snow doesn't get cleared, or the weather, there's supposed to be a warming up a little bit in the 40s, I think, next week.
Yep.
That we may not need to be concerned about next week. It may be the following week, the week of the 28th, that we would have to call for a brief meeting if we need to, if that's the direction things are going.
okay.
And me and Jenna will have pounded something out that will look like a sign, or look like some guidelines that we can post and so forth, well before that.
Right.
Oh, wait, the week of the 28th is vacation.
Yeah. But it's not clear, at least as it's not clear that the rinks are going to be ready to be used that week. If they are ready to be used, then I think we need to post the meeting on the 28th and have the meeting 48 hours, which would be the 30th. And we can-
on the next week, you don't have, doesn't have to be 48. It could be 72, 96.
oh, right.
you
Oh,
know.
I see. That's true.
So if on Monday, you just want to post for the following Monday, the 28th, you could do that.
Okay.
And you can also cancel them, right?
Right.
Last minute.
Okay. Why don't we do that? That's a great idea.
You don't have
Jackie,
to,
you have this?
you
You have
could,
this down, Jackie? What do you
Okay.
think?
We're posting next week for the 28th, and we'll see what happens.
yeah,
I'm
you-
sorry, Gene.
at any time that the board is inclined to meet, just because, I mean, I know 7 o'clock is pretty much the time slot that works, but if it's going to be a short meeting and there's availability some other time, that's an option too.
Especially if we can keep it inside staff hours, is always a good thing.
Sounds like it's going to be a quick meeting, so we'll make it work.
Okay. I think we're all set with the plan on that. That was easy.
Thanks, Jenna. I'll be in touch.
Yeah, thank you all so much.
Thanks, Jen.
Have a great holiday.
You too.
Bye.
Too. Bye, Jenna. Thanks.
Okay. So let's take it back to the top. Are there any incident command updates?
I
mean, the minutes came
yeah.
out. Yeah.
Yeah, I know the notes from command came out. I don't know if anyone had any questions about those notes. I know there's some stuff in process. Are there any questions? I don't want to belabor content that folks have read about. Peter?
Terry, you had a great report that you sent
Ah.
off to me yesterday. I mean, you can
Right.
paraphrase
Okay.
that. I thought there was some good information in there. Go ahead.
That's fine. Okay. So, well, so I'll start with the, I did a few things. So Laura and I had a call with, the MRC coordinator for Region 3B, which is what, Reading belongs to. And, that was very, very helpful. The coordinator is a longtime volunteer who's been tasked to be the coordinator in the last 6 months, 9 months or so. Very knowledgeable. So the regional MRC, which is 6 towns, has about 180 volunteers in it. Half of them are medical, half of them are non-medical. And in terms of their deployability, those numbers, like the number of folks that are signed up is always a lot bigger than the folks you're going to get who are able to volunteer in an incident. But so it's nice to hear you got a list of 180, because that means you have a bigger pool to draw from. There are apparently about 25 to 30 folks from Reading directly, and that's always useful, because folks who, when you're talking about your home community, so sometimes folks are more interested in answering a call if it's their home community. I mean, the MRC is a long-standing resource. It was created, back in, I think, 2005. And it's always been a question of, it's hard to keep volunteers activated and engaged. So this is an opportunity to see, for everyone to see, how they can be used. I was interested because I wanted to know what kind of training they had. I wanted to know what the numbers were. And, I wanted to understand whether they would even be an option if we needed to stand up a dispensing site, because you can use folks for traffic flow and the like. So it was a useful conversation for both Laura and I. Their federal resources aligned with the community's useful. So I'm going to follow up with that with Chief Jackson and Chief Burns, Laura and I will, about dispensing. And there are some other questions about use of volunteers in the community. And
That's the big one. I'm going to stop you just for a second. Let's tease that out for a moment, because apparently there's some internal regulations. I'm not sure. This is new ground for me.
right.
Can we use volunteers? Do they have to be SORI tested as well as Corey checked?
So
I meant SORI checked on that too, but go ahead, Carrie, continue.
sorry. Thank you for, so MRC volunteers are by rights Corey and SORI'd. You can't, you're not authorized to be part of the Corps until you've been Corey'd and SORI'd.
Okay.
I am aware of other communities that don't like to work with volunteers, and what they have done is chosen to make their MRC volunteers, their specific unit, special employees of the community to address that. So that's one way that other communities in Massachusetts have addressed it, because they felt that there was value in having these community members with specific training that might be useful to support town activities. So that's a yeah, I mean, that's a very big question, whether, is this a resource that the town can or will access? But I at least was able to move us forward, get some information on it. Now we can have the conversation about whether we use it and why. It would be, as I said, it would be in supported dispensing sites. It's also about, I mean, you can use them for other things. They do all sorts of things. They do phone calls to in other communities. They do phone calls to elders. They do food delivery. There's a great video from the MRC up in Westford. They're anchored out of Westford. They have done some amazing, gotten involved in a lot of different activities. So that was one piece. I think the other piece is that, there's a lot of discussion then, and this is going to kind of cross over into our testing conversation. There's some discussion about what are the resources for testing in Reading. What is, some towns are doing surveillance testing. What would that involve, and how to proceed with that? And there haven't been any decisions made on that, but there's been some initial conversation and information gathering to see how to move forward. And I'm sorry, Peter, I don't have my update, and I'm forgetting what else I said that was good.
Yeah, you got most of it.
I know that.
Yeah, the biggest piece that's always been a concern is this medical reserve corps.
Yep.
I mean, people, are wondering, how are we going to distribute this vaccine when it comes out, or how are we going to do testing if we don't have public-private partnerships? I don't know how we're going to do it. If we don't have volunteers, I'm not sure how we do it. But, Kerry just brought forth, the numbers there from the region, and, the plans on how we share those resources. I've not really seen how that's going to be allocated, but I'm sure it'll work out. If we have to, everybody will find an amicable way to figure out a schedule. We'll be able to share them. The only other piece, and it might be worth mentioning too, this Medical Reserve Corps, which has been around for at least 15 years or so. I mean, it was hard to keep them motivated, these volunteers, to stay prepared when there was nothing happening.
Yes.
And so a lot of them have maybe moved out of I don't know where they are by now. 15 years later, they lost interest. And so, I'm not going to put a whole lot of stake onto the Medical Reserve Corps, but it's good that we're talking about it, and Kerry is knocking on the doors, and Laura is there with her. And so that's the most important piece, I think, Kerry. The only other thing, we got word that, and I don't think we need any action, but just something else to think about, Sanborn Place. And I'm not sure where it is, other than it's on 50 Bay State Road. And Gene, help me out with this one. It's a housing complex, and I think there's an affiliation. They reached out to us through the senior center that they're affiliated in some ways with CVS, and they want to utilize their property to do dispensing if it's needed. I said I would toss it by the board tonight if I got a chance, and I sort of got a chance just now. So that we know. Jean might have more details on what that place is about.
I'm interested in this just because I know, so all the long-term care facilities, there's contracts through at the state level to have CVS and Walgreens do dispensing. So they're going to go directly out to facilities to vaccinate the patients and staff. And I'm wondering, I don't think they can expand to vaccinate. I mean, they're not going to have access to vaccine to vaccinate others. So I'm curious what they're proposing.
Well, just in one more moment, I got something from our, nurse advocate over at the senior center, who
Elise,
stated that she has a contact at the Sanborn Place, and Sanborn Place would be willing to share its facility. And that might mean, the flow of traffic would be adequate, and maybe in one door and out another if we needed it. And I said I would pass it along. And I don't know how that's.
They have a big dining room over there, Peter.
Say that again?
They have a large dining room over there. I'm sure that's probably what they're talking about, maybe setting up some kind of stations in there to get people in and out.
It doesn't fly in the face of our
We have
emergency
used it for flu
dispensing.
docs before.
Say that again.
What was that, Paula?
That we used it in the past for flu vaccine.
Okay.
Yes, we
distribution.
actually just had a flu vaccine, flu clinic there this year. And Marcy, who I believe is the coordinator, assisted with that. And there does appear to be a lot of room there.
good. So that kind of goes to the dispensing site planning piece, which we're working on again so Laura and I met with Chief Jackson and Chief Burns, reviewed the existing dispensing site plan that was, developed and then populated by Laura for Reading. And there's primary and secondary locations for that, but there's always the opportunity to do other locations. So that's kind of the discussion. I think right now there's a preference to do bigger sites, but maybe using Sanborn as an option. That's nice that they want a volunteer space.
I know. You hate to turn down an offer.
Right.
At least without some consideration. And,
Right.
thank you note goes a long way with Chicas. We gave
Yep.
it some thought. We're not sure how it will fit in, but, you're there for us and we appreciate it.
Yeah.
So anyway, that's
Yeah.
that. And to your point, Kerry, about your, report to me, I think you covered most of it. And the
Okay.
MRC was, to me, like the crux.
Before we leave the vaccination discussion, just,
Okay.
the state doesn't have any detailed plans beyond, this first wave is all institutional. It's to the hospitals and it's to the long-term care facilities.
Yep.
With Walgreens and CVS. So it's kind of already baked in there. But the next phase in terms of, first responders and everybody in that second phase, and certainly the third phase in public, there are no, I'm asking the question, there are no detailed plans currently that the state has for how the Reading police are going to get vaccinated, how the
Very timely.
folks at Market Basket are going to get vaccinated. We don't have any plans.
Well, let me just lead into this, Kerry, and you can take it over. Before we met tonight, we were a little bit early and we talked about an email that came down from DPH about just that, Rick. And Kerry, what would you take it from there, please, and talk about?
Sure. Yeah, so tier 1 is a long list and it does include first responders. And one of the questions that came out in the email today was DPH had, so there are plans, sorry, let me back up. There are plans. The question is, are the plans suitable to the numbers that need to be vaccinated, the available vaccine and the like? So there are plans that then you have to kind of tweak and adjust. It's not that there's no plan. The first responders question that has just come out is the state is assessing if there are any health departments that would have the capacity to vaccinate their own first responders. And so they've just put out a survey tonight, just before I logged on. They put out a survey asking folks to identify if they had capacity. You need to have staff capacity, you need to have a location, you need to have refrigeration capacity to support it. So, you know, I looked at it quickly. We were talking about it a little bit, Peter and I, just when we hopped onto the call. I don't think that, it doesn't look to me like because of the refrigeration, we are set, but we'll look more at that. So, sorry, that's a
Yeah,
one
so
piece
let me
of the
take it
answer.
back for a second, because Rick's point is we don't hear anything. There's certain things are baked into it, Rick, but we're starting to see some activity beyond that. And this is how it's going to unfold as we move along. They're going to give us a 2-week window and say, okay, where do we want to go from here? Who has the capacity? We're going to start to ramp up a lot of these services. You have this place that we've already approved. Let's move forward. It could turn out Reading. I mean, if they provided us refrigeration and we happen to be the best location for first responders in this region, you know, we might be setting up a tent at a nursing home parking lot and doing first responders. You can do it in a couple of hours. Come on.
Yeah. So that's tier 1, and then tier 2 is all the high risk folks. And there are, that's part of the state vaccine advisory board. You've seen them. They're working through their process, trying to figure out how that vaccine gets distributed. What's the best way? My understanding is they're working on licensures lists so that they can notify folks for this first tier, and then they'll have to work with the practices to identify the folks with the comorbidities, the age, and so forth, and then figure out how to distribute there. That's going to be complex. And then you get to the general public, which is where they're still saying that there may be a need for public health departments to stand up either local dispensing sites or regional dispensing sites in collaboration with other communities. So there are plans. They are being tweaked every week. And it's so exciting that they're actually able to do the vaccination for the healthcare workers, the COVID facing folks right now. Really exciting.
Okay. Any other questions on vaccination? I was thinking we might move to the Christine and then talk a little bit about testing.
Are you still with us?
Christine's.
Yep, I'm here. I'm here.
Hi, Christine.
Hello.
Hi.
Hi. So, do you want me to begin now?
Yeah, why don't you go ahead and.
Yep. Okay. So, well, as previously mentioned, Reading is in the red. The number of case counts continue to increase daily. I would say the nurses are acknowledging anywhere from 6 to 14 cases a day, as well as managing contact tracing. According to Maven, from the beginning of the pandemic to the present, it is a total of 799 cases. Total number of deaths, 40. And our active case count is 235. Moving to a community update with regards to the school, a Reading public school system right now. And I just like to mention I'm working in collaboration with the school nurses. I can give you, there's a total of 25 active cases. I can break it down a little bit. 8 are high school, 6 are middle school, 1 elementary, 1 pre-K, 7 staff, and 2 facilities. And of the 8 high school, 3 are affiliated with a hockey cluster. 23 students right now are quarantining on the hockey team, and contact tracing is being performed internally.
By the nurses, the
Uh,
school nurses.
Correct,
Thank you.
correct. Yep. Austin Prep, at the present time, there are a total of 9 cases. 7 students and 2 staff nurses are out, and 3 are associated with hockey as well. They have quarantined the hockey team, and I believe 11 students are being quarantined from the hockey team.
Excuse me for
Artist
just a moment,
senior-
but Kevin,
Yep.
raise your head on that from your comments earlier about public skating. This is a hockey,
Yep.
the hockey thing.
Yep. Mhm.
Yeah, I mean,
Um,
I think I would just say that, you know, skating in a closed rink like the hockey team does
Yeah.
is at higher risk just because of its enclosure, and they're checking, and it's a different environment than being outside in the open air in a non-checking. So it's a little bit lower risk, but you're right, Peter, you know, hockey is hockey. I'm sorry, go ahead, Christine.
Oh, that's okay. Artist Senior Living, there at the present time, there's a total of 6 cases. I'm working in collaboration with the Director of Nursing, AJ McDonald, and they are non-nursing residents. They are workers there. Thankfully, none of the residents have tested positive. Currently, they've all undergone multiple COVID testing, and they're going to continue to do the mobile testing, I believe, periodically.
Typically, they're
North
doing it
Reading-
every other day. I'm sorry, go ahead.
Yes, they are. Yep, they are. North Reading, I was just informed, North Reading Transportation, there's a positive driver that picked up a Reading student. There's some contact tracing going on there. And moving on to, I can go on to hockey, the hockey rinks in the area, or let me see, Home Depot. I'll start with the hockey. Burbank Arena, in collaboration with Ed Peduto, some contact tracing started last week. There were 3 cases out of that rink, hockey players that tested positive, 3 Reading residents. There was also a cluster affiliated with an Essex Danvers skating rink, and about 10 positive residents from Reading are affiliated with that. These are clusters in the system, and contact tracing is being done still on the Danvers Essex rink. Going back to the Burbank rink, last week, Laura was very helpful in getting Ed Peduto to provide a list of a roster. I didn't have the information, so she was very helpful in getting that, and we were able to contact trace pretty quickly because of that. And then I would say lastly, Home Depot, there's a cluster there right now, a total of 5 cases. Only 1 is a Reading resident. Yep, I've been in contact with the regional manager. They are putting some COVID compliance in place. And I do know that there have been a couple of previous complaints that have come through on Home Depot. The regional manager assures me they're being taken care of. And I will check back with him in a week. He also stated that he will report, any new cases to me as well.
There's
The
a,
Home Depot
can we
cases
go on
are-
for another moment about Laura's role at the Home Depot? Christine?
Yes, I'm sorry. So let me just going back
No, that's
to.
okay. Just want to make sure we get that piece covered.
Yeah, so I believe some complaints had come through in the past on Home Depot, which I know that she has addressed.
All right, I guess I picked on you on that one. Laura has instructions to follow through with the Home Depot right here in Reading to
Oh,
make sure
yes,
that
yes.
the spot
Yep,
checking
and then
inspections that she does.
That's right. I had reached out to see, and Laura's going to be doing some COVID compliance with the store itself and spot checking. Yes, correct.
The 5 cases at Home Depot are employees of Home Depot?
They
Right.
are, yep, employees.
And Peter, you had said that that the issues there had been around employees not wearing masks. And I don't know if they have been counting the number of people going in and coming out to keep, because I've been there. I haven't seen that. So
Yeah.
um,
We're gonna be watching and making records, producing some records on what the observations are. We need some better details on how that works. But the big things are the hockey rinks and now the box stores. They're falling, in line. And
Right.
I'm not sure what we do or what we prepare to do next, but I could be a wise guy right now, but it's getting late. The public skating rinks are one thing and now the box store is going to be a lot more difficult. I'm being serious. I'm not being a wise guy. If something happens where we need to intervene with businesses of that size, we're going to have to be decisive. And I'm not sure what it's going to take. And Jean's holding her breath too, but we'll work together as a staff before we come to you for a vote, and we'll have recommendations. Sure.
Well, and if I may, so I have a couple things. First, I'll say that I personally would be fully in support of actions because we know how contagious this virus is. That's the issue, is that the contagion is much higher than, say, a flu. And that's why we are concerned. And, so I have confidence in the work of the nursing staff and the staff that, you'll be assessing the circumstances and making sure that things, that it warrants further discussion. So thank you for doing that work. And I just want to go back to hockey, because, one of the things about how we keep talking a lot about hockey, and I think one of the important things about hockey is that it's not so much the playing of the sport. It is that the issue is that hockey, when there was this analysis of all of the cases and where things are coming from, hockey cases that happen to have been at hockey rinks have significantly higher numbers of close contacts. That's the problem. So it's about kind of, how folks that play hockey operate in the population. That's the risk. So it's not like, I've heard people make jokes and say, what, I put on skates and now suddenly I get COVID, but if I play basketball, I don't get it. It's it's not the skates. It's just the behaviors. That's what they saw, because they looked back at the data and how many contacts did each of these cases have, and hockey by far had much higher. So I think that's an important point.
So I would say, with respect to hockey, I know that Peter had a conversation with the manager over at Burbank, shared with him the most updated guidelines, because there was an issue around captains' practices where they're not done under I suspect these are not done under the auspices of the coach, the adult coach, but it's the captain getting a group of people. And there have been concerns that there were large numbers of hockey players going to these captains' practices. And, hopefully that practice has stopped, but I think we need to keep close eye on it. With respect to Home Depot, I share your concern, Peter, and so what is going to, however, I think we still need to pursue it. And what's going to be critical is, because Carrie shared with me this online public health educational thing. which has been very useful. And I looked at administrative warrants, and basically it's going to be critical that when there are infractions at Home Depot or any other store, that we have good documentation, right? That's
Exactly.
the key. And so you have to have a string of these where you've noticed it, you've told them, you've noticed it, you've told them again, and you've told them again, before you get to anything of what that the board's going to do. So I'm hoping that Laura or Dan or who's ever focused on this, Christine, is documenting those instances, because it sounded like from our conversation that the thing with in particular with Home Depot has been going on for a bit, back and forth over time. Anyway.
That's true, Rick, and just for one more moment here, Christine is involved, no doubt about it. But I think the way it ought to work is come through the director so that somebody knows who's responsible for the documentation and who's been there and who wrote up the report. And
Right.
like that does not fall on the nurse's lap. That would fall on the director's lap. And so let's just keep that, simple.
Okay.
Thanks.
Anything else? Anything else, Christine?
No,
Okay. Any other questions or comments from anybody?
I had just a couple, if I could.
Sure.
Hey, Christine, it's Kevin. How you doing?
good, thanks. How are you?
I'm doing just dandy. I have a couple questions for you in regards to the state on two things. On the contact tracing collaborative they have in Maven, for example, what is the lag time from a positive test getting into Maven? I know you're checking it daily, so it's not a lot of lag once it's in Maven. But what's the lag time getting into Maven? Do you know, roughly?
Yeah, so honestly, lately we've been seeing PCRs reported 24 hours later, and that is new, because I would say last month it was anywhere from 2 to 4 days, sometimes even the 5th day we were getting it, which is,
wow,
it's just too long.
Yeah, it is.
But this month it's been pretty on point. It's been 24 to 48 hours.
Okay. And I know you have your contact that you talk with down at the state all the time. I came across an instance in another town that the lag time for the state to get in contact was 1 week.
Yes, the CTC has changed their guidelines, and it has been difficult for them lately. I know they've hired a bunch more people, and what they're doing now is sending out a text if someone provides a mobile phone to try to reach them quicker. But they are days to a week behind, which is why the nurses and I prefer to keep it internal and
Absolutely.
try to do as much contact tracing as possible.
So at what point do they wait? I know they're waiting to see if the town and the city is going to pick it up. Is there like a set number of days they wait before they even try to pick it up?
Well, what was happening prior to 1 week ago, actually, is when the nurses and I had a follow-up meeting with the CTC, is they were acknowledging it the following day. In other words, if the public health nurse doesn't acknowledge, they would see it within 24 hours.
Okay.
Now they're not able to do that. It's more like days to weeks, which again is a little bit concerning. But we've not had to utilize the CTC yet. I do know that some of the nurses are asking about holidays and, if we were to use them, what we would do. I know so far we have coverage, but you know what? I'm sorry, that doesn't answer the question. Can you ask the question again? I'm sorry.
That's okay. It's okay, Christine.
No, I think
I'm
you're
just
on the right track.
I'm getting around in a roundabout way. I just want to make sure there's emphasis on the board that we can get you as much support as you can. Obviously, a week, as you can imagine, lag time can just absolutely wreck the system completely. So,
Yeah.
you know, if at any point in time you feel like it's getting to that point where it's tough to keep up on it, just let us know whatever we need to do to help
Sure.
support you. I'm glad to hear that. It sounds like we're close at least to having another public health nurse, which is great. I just want to make
Yes.
sure that we, as you said, keep it in house. That's great. You get 24-hour turnaround is excellent if that's their turnaround. So I was just wanted to kind of get to that point, but I was curious to find out what the actual numbers were as well. I just had a couple other questions. If you bear with me, I know it's getting late, folks. So I asked this question, I think last time. I'm probably going to ask it the next time, Christine. How sick are we seeing these folks? Are we seeing very symptomatic folks? And if we are seeing a lot more symptomatic than asymptomatic, what are those symptoms? Is it consistent? Is it not all over the place?
Yep. So, first I'd like to just say that the number of cases we are seeing are really linked to household contacts. So that's like, mom, dad, multiple children, multiple people living in a household. That's what we're seeing. The age is anywhere from 5 years old all the way up to 80. Out of all our active case right now, there's only 2 hospitalizations and 1 is already out of the hospital. So people are recovering. What's very interesting is some of the hospitals are offering the treatment that, they're giving them the immunotherapy for it, and people are recovering. Some of the older folks that have comorbidities are recovering quicker.
Great.
People just don't seem to be as sick as, the beginning of it.
So I guess my question's kind of around, I probably know the answer to it as I ask it. I feel like because we're seeing the less of symptoms of folks that are sick, we're seeing the spread of it go up. In other words, more people walking around that feel fine aren't testing because they're not running a fever, they don't have a sore throat, they can smell and taste it, right? Yeah, but they're walking around with it, they're transmitting it.
Yes.
I feel like that's what we're seeing from this spike. Do you agree with that?
I do agree with that. I do.
Okay. And so this is a curious question. I know it's late. You can bear with me. This one's from my own curiosity. Sorry. So when you are contact tracing, are you getting multiple positive hits from those contacts?
Yes, we are. The problem with contact tracing is
I should say outside of a household. I should say outside of a household. Obviously, you're getting multiple hits inside them.
We are. Some people are more forthcoming than others. Some people really don't want to give that information. So we have to develop a very rapid, quick, trusting relation with the person we're on the phone with. And I think the nurses do a great job with that. But, I would say it's 50-50. Some people are very willing to give us that information and others just really don't want to do that. But we trace back 48 hours. I would say the nurses I work with, we even go above and beyond that. We really do try to get a good, a good picture of contacts they've come in close contact with. Close contact, as we all know, is, within 6 feet for more than 15 minutes. Some people just say, well, I walked by somebody and we both had masks on. It was just for a second. Is that a close contact? So it's really, it's a lot of education involved as well.
Mm-hmm. Okay. Well, you're doing just a phenomenal job. I can't stress that enough. Thank you very much. I appreciate everything that you're doing.
Yes. Thank you. We're certainly trying our hardest.
If I may, I just have Christine, it's Carrie. I have a clarifying question on what you just said about the close contact piece. Because it's 15 minutes over a 24-hour period. It's no longer the cumulative 15 minutes that you need to spend time with someone to be considered a close
Yeah.
contact, right? Yeah.
Yep, I'm sorry, Carrie. So it could be like 5 minutes here and then 5 minutes. You're right. And it
Yep.
could be 5 minutes there. Yes.
Right. Yeah. No need to apologize. I think that's an important change that not everybody has caught up with.
Yep.
Just like we know quarantine has changed, and boy, have I gotten a
Oh.
lot of questions about quarantine changes.
Yeah.
And I,
Especially the most current ones are
Yes.
a lot of people are really
yes,
confused about that.
yes, and thank you, because I know how hard you guys work to communicate that clearly and quickly to people who don't feel well or are suddenly quite surprised that their world is they have to restrict their activities. So
Yeah.
thank you. It's a lot of work.
Sure.
So it is 9 o'clock, and I think what I'd like to do is just to get 5 minutes from Jean as to how the discussion went around the budget that we talked about last time. And then we can, hopefully quickly approve the minutes and we'll be on our way. Jean?
Thank you. Yeah, we had a good discussion at the select board past Tuesday night. I walked them through the whole budget, but obviously the health division budget was something that I spent a fair amount of time on, because that's really one of the big areas that in this budget, which is the ask budget. This is the budget where the town manager says, prepare a budget and don't worry about guidance and don't worry about money. So you can worry about money, and I ask all kinds of stuff, obviously based on what the board has been talking about and all the work that we've done over these months, thinking about getting obviously the biggie is the full-time public health director. It's been such a tremendous asset to have Peter here as the interim, to now springboard that into something full-time. And my hope is that we can continue to keep Peter on. I have all kinds of ideas, but I know he's retired, so I don't want to push the envelope. But the budget does afford that the way I drafted it. And also having more hours for the public health nurse. The nurse that we're very close to getting is probably going to start at like 10 hours a week. I have some flexibility in the budget and hope that it will be more than that. But certainly by July 1, that budget increases that almost double. So so that's those are the two key areas for staff.
Right. And so was the reaction from the select board in your guesstimation positive, negative, neutral?
I think they were very supportive. We talked about FTEs. A question came up about that. They wanted to really understand the health ask and where that sat in the budget as drafted. I think I might have mentioned in our last meeting that I have an admin budget that's broadly for the department, and I put a lot of money there, like 45,000 for outsourced professional services, anticipating that this board would be able to use those funds for some of the planning work that you're talking about, in addition to the 20,000 that's there now, or however, any which way it could go. But the select board was very interested to understand it a little bit more, and I thought generally supportive. Now, to be clear, the real challenge is to now have the town manager take these budgets and for balanced budget.
Right.
And so, as we all know, those of us doing budgets, you ask and you don't always get. But I think given I can't speak for the town manager, but I think he's been at these meetings. He's heard. The message has been fairly loud and clear that a full-time health director is not a frivolous ask. It's important.
Okay, great. Thank you.
Thank you.
And then finally, hopefully everybody's had a chance to read the minutes from the last meeting on December 3rd. Are there any amendments, adjustments, suggestions? Look pretty good to me. We have a motion. Oh, Paula, go ahead. Yes, Paula.
I had a question. Under the section where Jean was just talking about the budget, could I have a clarification on the total? Because it didn't seem to me that the items added up to the total. I think it was the second paragraph on the minutes.
Oh, so
I
you're
have to pull it
saying,
up again. I had to shut my phone down because
so Jean, it says
I'm trying to pull it up again.
significant changes totaling 156,000. Increase in salaries included 160,000 for health director. So that's already more than 156. And then an interim director. And then, 60 to 80 for public health nurse and 10,000 for overtime. So it seems like all those things are way more than 156.
The reason that the numbers don't add up is because there are some other things in the budget, like the town manager requested 50,000 for, to bring Peter in, basically. So that hasn't been asked for again. That's why the net amount is 156,000, because there are other line items in the budget right now in FY21 that aren't being funded, like that 50,000. So the net is 156,000.
Okay, so the 156 is really the change
Yes.
between the 21 and 22 budget.
Yes.
Okay.
Okay. Thank you.
Have a motion to approve the minutes?
That was my only comment.
Okay.
So moved.
Roll call, Carrie. Yes, you're on mute. Okay. Paula?
Yes.
Yeah, and Rick?
Yes.
Okay, minutes approved. And I think that's it. Happy holidays, everybody.
Yeah.
See you next
Thank you.
year,
Same to you all.
unless we have a meeting
Yes.
the week of the 28th.
Unless-
Yeah.
Unless,
Sharpen your blades, well, folks. If you're going skating before the holiday,
Yeah.
before next
Happy
year.
holidays, everybody.
Nice meeting, folks. See you soon.
Happy
Christmas,
holidays.
happy holidays. Be
take
well.
care.
Bye now.
Bye.
Bye-bye.